So you may be disabled and you rely on government benefits to provide your income and your health insurance, but you still want to work because a lot of us, we want to work and be able to make more money. Or maybe you've received an inheritance and there's some income that's being generated from that inheritance and you're worried, will that interfere in my public benefits? So what should you do? In this video, we're going to talk all about income limits and how to make sure that you can preserve your public benefits even while receiving income. Okay, so the first public benefit I want to talk about is Medi-Cal. All right, this is California's version of the federal Medicaid system. And I have a very popular video all about Medi-Cal and Medi-Cal updates in 2023. So you may want to go watch that. One thing I talk about in that video is that eligibility limits for resources is actually being eliminated. It used to be that you can only have $2,000 of resources, and that would disqualify a lot of people from Medi-Cal. Well, guess what? That's going away in 2024. Yes, I'm really excited about that. So now we're really looking at income. How much income can somebody receive and still qualify for their Medi-Cal health insurance? Well, guess what? There's a handy dandy chart that the Department of Healthcare Services has put out, and I want to look at it with you. So here's the chart. So it asks, do you qualify for Medi-Cal benefits? Again, this is from the Department of Healthcare Services website, so you can look it up too. So you'll notice that this is based on the poverty level. If you have a family size of just one of you, if you're single, then this is how much you can make in a year, about $20,000, which if you divide that by 12, that's about $1,600 a month. So that's how much income you can earn and still qualify for Medi-Cal. All right. If there's two of you, it goes up a little bit. That's about $2,270 a month that you can earn. So as you see, as the family size increases, the amount of income you can have increases. So check that chart to see if you might qualify. So then the other health insurance program that we should talk about is Medicare. What about Medicare? Is there an income limit? Well, yes and no. There's no income limit per se, but the higher your income is, the more you'll have to pay what they call an adjustment amount. Here's a chart that we can look at, all right? And what they do is they look at your income from 2 years ago, and then they base the additional amount that you might have to pay for Medicare. Now, this is for Part B, for what I think is the main part, the hospital and doctor care, right? So you can see if your income is lower and you're a single person, is lower than $100,000 per year, you're going to be paying about $165 a month in your income-related monthly adjustment amount. And then if you earn more, between $100,000 and $123,000, it goes up a little bit. And it keeps going up until if you earn up to $500,000 or more, then you're paying about $560 extra per month. So you will receive Medicare, but it just depends on how much they're going to make you pay in the adjustment amount. Now I want to pause here. If you're finding this information helpful and you think somebody else in your family might enjoy it or a friend, I ask you to press that share arrow and you can share this video with somebody else who might really benefit from this information. So now let's talk about Section 8 housing. So Section 8 housing, they look at your income, and for a long time they haven't looked at your resources at all, but they're going to be implementing a resource limit soon, and I will make a video on that. But let's look at the Section 8 housing one. Now, their chart is not simple, and here's why. It's based on the area where you live. As all of us know, some areas in California are a lot more expensive to live than other areas. And in the more expensive areas, you'll find that the median income is much higher. So here's a chart that it's really small, so you can zoom in. But I just want to mention, so let's say, so here are the different areas in California. For example, here's Chico, all right? And Chico is in Northern California. I love Chico, okay? I have a best friend whose family lives there. But it's not super expensive to live in Chico, relatively speaking. And so you'll see if you're a two-person family and you are at the low income limit, which is 80% of the median income. There's very low, which is, I believe, 50%, and then low income is 80%. So 80%, you can qualify for Section 8 housing if you earn $52,800 a year or less, right? So that's the number in Chico. However, look down here in Santa Ana, Anaheim, Irvine section in Southern California, it's a lot more expensive to live there. Surprise, surprise. And so if you have 80% of the median income is $91,850. So if you're earning less than $91,850, then you can qualify for Section 8. So it really does depend on where you live. And we'll have a link to this chart so you can take a look. Okay, so now what about Social Security disability insurance? Well, that one is interesting because they only look at your income that you're earning. They don't look at unearned income. They only look at the income where you're working and you're receiving a salary. And for that income, they have an actual limit, okay? That number is about $1,470 a month. So you can keep receiving your SSDI or your child disability benefits, your CDB benefits, and make up to $1,470 a month. Anything over that, and you could lose your SSDI income stream.
Hey everyone, if you like my mom's video, like and subscribe.
So the last one, and the most complicated one, so I saved it for last, is Supplemental Security Income. So how does this even work? How much income can you receive and still get SSI? Right, well, so first of all, SSI is intended to supplement any income you're already receiving. But that income you receive is treated differently, whether it's earned income or unearned income. Now, the most you can get under SSI this year in 2023 is $1,133. So it's indexed for inflation. It goes up a little bit each year. Not nearly enough, by the way. I mean, that's supposed to cover your food and your shelter, right? So forget it if you're here in California, but every little bit helps, right? So let's see for each one, how does it work for earned income and unearned income? I'm going to give you some examples. Okay, so for earned income, they actually want to somewhat encourage you to work. So what they do is the first $20 of earned income is a freebie. They don't count that at all. That's go to the movies, enjoy yourself, just yourself, because that'll pay for what, like a movie and popcorn, maybe? And then they also don't count the first $65 of your earnings. And after that, they count half of anything you earn above that, all right? So basically $1 of income will reduce 50 cents of SSI. Now let's compare that to unearned income. So if you're receiving, let's say, getting SSDI from the government as well, that's unearned income, or workers' compensation, or you're getting gifts from other family members, or you have a special needs trust and it's distributing cash directly to you. All of this is considered unearned income. And for that, they give you the same $20 freebie, the go to the movies freebie, but after that, you don't get an extra $65 freebie. After that, it's dollar for dollar, all right? Every dollar that you earn depletes your SSI income by $1, all right? So there's a great disincentive to receive unearned income and still get SSI. So here are some examples, all right? I'm gonna show this to you. So let's say Sarah, that's the name of my niece, and it's also my middle name, so I love that name. Let's say that Sarah earns $600 at her job, all right? So how much SSI can she receive? Well, first we do the $20 freebie, then the $65 freebie, because this is earned income, and then we reduce 1/2 of the remaining amount, the $515. So that's $257.50. That's the deduction of her SSI. So if she's receiving $1,133, the maximum amount of SSI that you can receive in California per month, they would subtract $257.50 from that amount, and she can still receive $875.50 of SSI, even as she works and gets $600 a month of earned income. Okay, so now let's compare that to unearned income, all right? So let's say Sarah receives $600 a month of SSDI, all right? And a lot of people actually get some SSDI and some SSI, all right? So she gets $600 a month of SSDI. So the first $20 doesn't count, right? Enjoy the movies, go have fun. and then it reduces it dollar for dollar. So the $580 of remaining of the unearned income from SSDI will deplete her SSI. So now she's gotten, she can get up to $1,133 a month, and then we subtract the $580, and now she's getting $553 a month of SSI. All right, so you'll see you can get more when you bring in earned income for SSI than you get for unearned income. I know, it's complicated and confusing. Why do they do it that way? Beats me, but that's what we're dealing with. Okay, so now I want to give one more example. Let's say that Sarah is disabled. She became disabled before age 22. Let's say it's a developmental disability. And then her dad retires, okay? And he receives $1,800 a month. Well, Sarah can actually get half of her dad's income stream at the same time. So she can get $900 a month of income at the same time that dad gets $1,800 a month of income. And this is one of the best kept secrets, by the way. So make sure when you have a parent who retires, make sure that your kid asks for this child disability benefit. So now what happens to Sarah's SSI at this point? Well, it's decreased by $20 and then by the $880. So now she's getting $253 a month of SSI benefits. Now let's say Sarah's dad dies and he had $1,800 a month of benefits. So now her benefits increase to 75% of what dad used to have. Whenever you have a parent who dies, then you get 75% of their Social Security for CDB benefits. Okay, so her CDB benefits go up to $1,350 a month. Now you'll notice that that is higher than what you can get for SSI benefits. So she's not going to get SSI benefits anymore. All right, those are discontinued, but she still gets $1,350 a month. Okay, so that's our primer on how much income can I have, can I earn, and can I receive with unearned income and still receive this. So I do have a video that talks more about income streams, talks about SSI versus SSDI. And I encourage you to watch that video. I also ask, if you like these videos, I ask you to hit the notification button, the little bell icon, and that'll let you know, that'll alert you when we have new videos that are released, and we release videos every Monday, so weekly. So we look forward to seeing you with more of our videos.
Hello everyone! If you liked my mom's video, don't forget to like and subscribe. See you all next time!